Lime's mission is to provide an easy way for patients to connect with the healthcare system to ensure their individual and collective voices are heard. By collecting the perspectives and outcomes as reported by patients themselves, the healthcare system can gain valuable insights, leading to collaborative improvements in experiences and outcomes for the people it serves. To do this effectively, healthcare organizations require an agile platform designed for patients and providers that can be easily implemented, focused on a simplified user interface, and with scalability across the healthcare system. Lime Health is delivering on each of these priorities, and this is how we actually accomplish our mission. Lime works with patients to improve patient care through different ways. Basically, in light of the current state of healthcare systems worldwide, it is crucial for organizations to collaborate with patients and citizens to gain a better understanding of the obstacles to access the challenges faced throughout their healthcare journeys. Together, they can identify solutions that benefit both patients and providers and create substantial value. Lime Health's platform aims to bridge the gap between patients and the healthcare system, giving every patient a voice. This approach leads to improved care experiences, better quality of care, and enhanced outcomes, ultimately contributing to the development of a value-based system of care. Let me explain in a nutshell how Lime platform works, basically, and what it does. So the Lime platform offers a SaaS for healthcare organizations, or a software as a service, to measure and manage the patient outcomes and experiences in real time. Our software increases patient engagement, patient satisfaction, and quality of care by improving communications throughout the patient journey. Lime integrates with EHR systems to automate sending of key patient learning content and surveys to the right patient at the right time via an hospital-optimized workflow. So there are different reasons why we decided to exhibit at the ICHOM 2024 conference this year, and we also have different objectives and goals in terms of attending this conference. So first, Lime Health is really thrilled to be given this opportunity to work in collaboration with ICHOM as an exhibitor for this 2024 edition of the conference. We deeply believe in the value-based philosophy of care, and we're dedicated to helping organizations better understand what brings value to patients and their care encounters. By doing so, Lime is assisting healthcare organizations in working towards achieving a deeper understanding of the patient perspective and its importance in driving changes to how care is delivered. This, in turn, can have a positive impact on patient outcomes and help achieve cost savings. For us, exhibiting at the ICHOM 2024 conference is an opportunity to align our company with the forefront of healthcare innovation and quality improvement. Now, in terms of goals at the ICHOM 2024, we first want to continue our learning journey into value-based care and deepen our understanding of how to support our clients in achieving this through the use of our platform and the analysis and utilization of patient-reported data collected. As a positive impact company with a drive to bring value to the healthcare system, we're constantly innovating and pushing limits to ensure maximum benefits for our existing and future clients and ultimately benefiting patients. Also, we're hoping to nurture existing relationships and build new ones. Lime Health has established a global reach from Quebec to Ontario and British Columbia to Belgium and Luxembourg, to name a few. We're excited to see familiar faces, but also to build new relationships with experts and others doing this important work on improving outcomes for patients. There are indeed some particular projects that we're currently working on that we would like to highlight to the ICHOM community. As mentioned previously, Lime Health is working across a variety of jurisdictions, and this has led to some really exciting projects that are currently underway. For example, we are currently in the initial stages of a collaboration with a surgeon in British Columbia, Canada. The surgeon aims, in that case, to utilize the Lime platform to gather patient-reported outcome measures, or prompts, and to facilitate knowledge translation and patient engagement efforts with their patients. This project seeks to illustrate the significance of involving patients throughout the peri-operative process and to use PROMs for care planning and assessing the beneficial effects of these activities on post-surgical outcomes and cost reduction. Also, in Quebec, we are collaborating with our long-term partner, the Centre Hospitalier Universitaire de Québec, on a project supported by Healthcare Excellence Canada. The project here aims to enhance the experience and outcomes for patients waiting for orthopedic surgeries. As we all know, the pandemic has worsened wait times and delays, leaving many patients in vulnerable situations. This particular project introduces a new patient care pathway that includes patient evaluations, vulnerability screenings, educational materials, and improved communication channels. By involving patients and their caregivers throughout the waiting period, the project aims to improve patient self-management, knowledge, and satisfaction, ultimately leading to better preparation for surgery, reduced cancellations, and optimized surgical planning. This initiative aligns with the government's objectives to deliver accessible, high-quality healthcare and reduce surgical wait time. Finally, but also in Quebec, we are collaborating with over half of the regional health authorities and the Ministry of Health and Social Services to evaluate patients' views of healthcare experiences across various units, including the emergency department, psychiatry, surgery, and ACU, among others. Lime has developed a platform to automate the collection of patient-reported experience measures, PRAMs, from start to finish and provides data to the government's performance dashboard for benchmarking and quality improvement purposes. We're actually looking at a significant number of things forward at the ICHOM 2024 conference. Of course, there's always a lot of positive energy and excitement at these types of events. We're most excited to join the collective at ICHOM 2024 to be surrounded by leaders, vendors, patients, and others who are deeply committed to seeing positive changes across the healthcare systems throughout the evolution of value-based healthcare and listening to those who are served in the system. At one point or another, we will all be patients or have family or friends who are patients themselves. So contributing to improving healthcare experiences and outcomes is our passion, and we are grateful to be a small part of this great event.